want, we can start the meeting now, yeah?
Yes, sir, we can start now.
Okay, I will start now. Okay. Thank you so much to be here, and thank you for your invitation to present this webinar, all right? I will present to you, all of you today, something regarding with physical rehabilitation. No, we treat the topic of today will be related with the rehabilitation topic in osteopathy and how we call that the postural osteopathy. And I will try to explain in a webinar the concept of our philosophy. We see here something regarding with rehabilitation, that is the osteopathic point of view. You are physiotherapists, all of you, you are study physiotherapy, and osteopathy is one of the concepts that related with physiotherapy. But why we said postural osteopathy? But it's the same for physiotherapy. Physiotherapy, postural physiotherapy. If you don't know me, this is a little CV. I am the director of the R.M.P International School. We are an international school. We teach all around the world, in America, in Europe, and in Asia. And shortly we will start cooperation with your university also. Many years ago, I studied the concept of posturology, posture. You know, I travel all around the world, and I am teaching in different universities around the world, and I am teaching for all medical sciences. In our school, we teach for medical doctors, for physiotherapists, for osteopaths, for dentists. We teach how to work together with the same protocol. You know, it's very difficult. If we don't speak the same language, it's very difficult to understand the meaning of collaboration. Collaboration is, you know, very important in our school. If we need to collaborate, we have to have the same exactly point of view in diagnosis and treatment. You know, when you speak the same language, you see the patient in the same way, you are doing the real interdisciplinary treatment, not just holistic. Interdisciplinary, that is my point of view. We need to work together. What is posture? That is important to understand. What is the posture? Very good question. The human posture is the way the human body orients and maintains itself in space. The body needs to process a lot of data in order to create the correct muscle tone. That's a very important concept, because we stand up because our tonic postural system is creating our basic muscle tone, and that's very important. You will see in rehabilitation. For this reason, the central nervous system have postural receptors. The postural receptors who send the information to the environment to go directly to have the posture we need to live in that environment. This is a neurological complex. It's very simple, but we have to understand what is working. This tonic postural system have a central point that is the central nervous system that elaborates our life. But for that reason, we have receptors, we have peripheral receptors. And it's very important if you understand the concept of proprioception. We live through proprioception. Proprioception is sending to our central nervous system we were talking about the postural tonic system. Postural tonic system is a very important complex in our body that elaborate the basic muscle tone. And pay attention to it, because you physio, you work every single day with the muscles. And imagine if the central nervous system receive a wrong proprioception, the muscle tone will be wrong. And if we cannot annulate this situation, our rehabilitation will be not perfect. And that is important to understand. It's very, very important to understand. Remember that central nervous system, this is a very important system in our body, but the main thing is that system will adapt it through our evolution. In our evolution, when we stand up, we needed a new body regulation. Imagine a system that is a cybernetic system that regulates our muscle tone. And in that way, it's very important the proprioception. Eyes and foot support, they are the main receivers of this system. One for the top, the other for the bottom. There is a lot of proprioception, but mainly these two. If I try to introduce a concept, as I will tell you before, about craniofacial system, and mainly for the mandibular position, because nobody takes care of it. And craniofacial system, if the jaw position is not in a good centration, we will have an stress to the muscle chains. That's why we said in our school, craniofacial system is a big disturber of our posture. Remember that concept. It's important for you who do rehabilitation, but also it's very important for dentists that dentists see only teeth. Craniofacial system, you will see how is disturbed. Yeah? The feet is the connection with our ground. Send the main information of the ground to the central nervous system through the neurophysiology. The mandibular position, that's the key, because nobody in medical science pay attention on it. Jaw position have to be centrated in the glenoid cavity. I will explain during the webinar why, but focus on it. And the eyes from the top, we have two receptions, many receptions, main reception. Eyes from the top, foot from the bottom, in the middle, a big disturber. And you will see why I am telling that. And that is an important concept in rehabilitation, that nobody take care, even dentists, but even physiotherapists and osteopaths. And if you understand craniofacial system make interferences into the body, you cannot have a good rehabilitation if you do not annulate this situation. We will talk about that later. The NPR is a method that I created 40 years ago for all medical sciences to work together with an holistic point of view and with the interdisciplinary concept. But I want to stop a little bit here in interdiscipline. We think interdiscipline is to send the patient to another specialist. That's a derivation. Interdiscipline is when all medical science are seeing the patient with the same point of view and they speak the same language in diagnosis and therapy, and that's very important to work together. Okay, we carry on. Myofunctional postural rehabilitation overview. I want to try to explain very shortly what is myofunctional postural rehabilitation. It's a method. There is not a technique. It's a method for diagnosis and treatment for all medical sciences to have a holistic balance. And I think that is very important in physical rehabilitation. The body balance can only be achieved if all parts of the body contribute in this balance. All medical science have to work together. Medical doctors, osteopaths, physiotherapists, dentists. That's why we said postural osteopathy. The main concept in NPR is deprogram and reprogram. What I mean? Deprogram is the method to annulate the aggression to the central nervous system. And the reprogramming is to put in working in a new way, correctly, the whole body. Deprogramming and reprogramming. Balance of the body is mind, structure, and biochemistry. Remember that. We have to study all these things. Psyche, the structure, and the biochemistry. That means alimentation, intoxication, how we eat, how the body is cleaning. Because we cannot have a rehabilitation if we don't put in balance all the things. Normally, the rehabilitation is working in structure only. Holistic interdisciplinary protocol. This is a revolutionary concept. It's an interdisciplinary protocol. We have in our protocol, we have a clinical diagnosis, an instrumental diagnosis, and complementary analysis, because we have to study biochemistry also. In that diagnosis, we establish the priority, the main disturber for the body. The NPR protocol, I will try to explain shortly what it is. What is NPR? It's a diagnostic and therapeutic method that uses tools of different disciplines in medical sciences. And the purpose is to have a balance between the craniofacial system and the rest of the body, to have a good balance, to have a good rehabilitation for a long time. NPR protocol is an active protocol. that is adapting to the patient evolution. It's integrated because specialists intervene with the same diagnostic and therapeutic approach. And it's interdisciplinary because various disciplines working together. And what is NPR? NPR is the tool of the protocol. And it's myofunctional because it's doing a neuromusculoskeletal balance physiologically. It's postural because it's a rehabilitation between the stomatogenetic system with the body. And it's rehabilitation because rebalance all systems. That's why we said interdisciplinary. What is a healthy posture and how is it measured? We try to explain shortly posturology. Healthy posture can be identified by several parameters that can be tested clinically, such as postural planes. Postural planes, when they are parallel, that's biclavicular plane and biiliac plane, they are parallels, good health in the posture. But they can be alterated, and this is a good diagnostic method. These are the planes. And the torsion of the clavicular plane. When we have balance, all these planes are in the good position. And we have to have a muscle change balance to have a freedom of movement. Freedom is the main concept in osteopathy. Osteopathy basically said freedom is life. And that's why we have to have a muscle change to make freedom in the movement. Talking about the receptor, eyes. We tested the eyes with the oculomotor system. We tested the convergence. We tested also the vision, but we're talking about here about convergences. The convergence, main receptor. When we have altered the convergence, we lose the peripheral vision and our head adapt and the whole body change. That's why it's important to have a good convergence. And the jaw position, imagine, again, craniofacial system. When the jaw position change, it's alter one of the main receptors. The lateral deviation, the forward position, they are creating hypoconvergence. That means alteration of the movement of the eyes and losing the peripheral vision. Imagine that in a person the whole day who have lost the peripheral vision. That is creating a lot of alteration in our body. The foot support, we have different foot adaptation. Mainly, all of the problem in the foot, they are adaptation. Just 5% of the problems is causative problems. That's why we don't need insoles ever. We have to make a diagnosis in the foot support to act. The main work in foot support is osteopathy. Unblock the foot, not just insoles. We have magnetotherapy and different things. But if you have a good diagnosis, you can have a good treatment. You know very well as a physio Kepanji. Kepanji is a physiotherapist who studied the body weight distribution in the floor. This is the schema. The 3-6% in the calcaneus, 2-6 in the first metatarsus, and 1.6% in the fifth metatarsus. This is a triangle of health in the foot. Good distribution. If we create a triangle, the bisectrices of that triangle, when they meet, this is the barycenter of the foot. This is the concept you will see later of the posturometer. We can measure that. We can do clinically and with an instrument. Posturology and posturometry. We use both in our diagnosis. Posturology is a medical science that studies the static posture of the body. And posturometry is the medical science that measures the static posture of our body. Clinical and instrumental. The good combination for diagnosis. The study of posture is centuries old, but until recent decades, the diagnosis of posture was conducted by test and clinical analysis. Posturometry is a science that measures that. That's why we said measure is important. That's posturometry. That is a posturometer. This instrument to measure the posture of our body. With this instrument, we can do a lot of diagnosis in just 30 seconds. With the software, this is the posturometer. With the software, it's very simple to use. It's a very clever software. Obviously, you need the preparation to understand the software and the diagnosis, no, but it's very simple when you understand. Posturometry. With the use of load sensors, we are able to chart a person's static posture, center of gravity, and load distribution. Imagine what important is to measure. The body weight should always reach the ground 50% in each side to maintain optimal muscle change balance tone. And imagine if we have a receptor who is sending bad information or wrong information to the central nervous system, this situation changes. And you can measure that. You can measure and you can say that is where we have to start to work. The posturometer from Silverstone. We see now clinical diagnosis, instrumental diagnosis, and complementary diagnosis. No? We study the oculomotor system, postural analysis, the stomatognatic system analysis, and the foot support. This is clinical. The posturometer measures that situation. We can measure the eyes, we can measure the foot, we can measure the jaw position and the stomatognatic system position, if it's disturbing or not the body posture. Clinical opinion is an opinion. If you measure, it's science. Look at that. That is the software, and we have two situations. We have mouth open, no contact with teeth, and it's an overload. Mouth closed, another overload. Look at how it's changing. Just closing the mouth, it's changing the posture. Another case, worse, with the mouth open and mouth closed, you see 4 kilos in that situation of overload. Imagine that situation, the whole life of the patient is creating overload, disease, problems in our body. That's why it's important to measure what happened. The study of stabilometry is fundamental also in the diagnosis. The stabilometry is showing us the barycenter of the body. You know, I don't know if you know, but if it's not, I tell you, our body is looking every second in the best barycenter of our body, closer of the center of gravity. You know why? Because it's using less energy. Central nervous system is trying to find every second the best barycenter of our body, closer to the center of gravity. Because in that situation is using less energy. Sometimes to obtain that is creating adaptations, and chronic adaptation is creating disease. That's why it's important to measure that. Look at here, the barycenter of the body. We study 3 values here. I cannot do a lesson about posturometry, but shortly I try to explain. The variation of velocity, the relation form, and the area. The body do more movements forward and back than lateral. The covering of the barycenter is showing us the muscle tone of the body, and the variation of velocity, the comfort level. This is the comfort. Higher is the value, more uncomfort of the body. This speed. Relation is the promedium before sagittal and lateral oscillation. Less is the value. Our body is doing more oscillation sagittal. Imagine a patient who have a vision problem do more oscillation in sagittal. A patient who have equilibrium problem, they have more lateral oscillation. Imagine the things you can measure with an instrument. No? And the area, that's important for you as a physician. The area, this area recovery. Less is the area, more hypertonic. Higher is the area, is hypotonic. Imagine you can measure the body muscle tone with an instrument. This instrument is created with the concept of Scapangi. And many years ago, I studied how, that was a research I did more than 30 years ago, what happened with the pre-contacts of the teeth who are changing the jaw position. The pre-contacts in the anterior area of our mouth, that means incisors and canines, decrease the load on the first metatarsal. Imagine a dental situation which is creating problem in the foot. Imagine that what happened chronically, and you can see that early, and you can prevent disease in the future if you have an interdisciplinary protocol. Pre-contacts in premolars and molar is decrease the load in the fifth metatarsus, and pre-contacts in the last part of the teeth, second and third molar, decrease the load in the calcaneus. You can identify that with measurement. This is the schema. And this is another way to see the schema. Imagine pre-contacts in the mouth can alter the foot support. Imagine here, you can measure that. You can measure that. Here, loose, maybe there is a pre-contact here who is losing the load here. Another case, pre-contacts there. Increasing there the load and increasing the overload. Imagine a pre-contact in the teeth is altering the foot support. That's why we need an interdisciplinary diagnosis. Look at here and here. We can see with an instrument different situation. Look at how the pre-contact make a torsion in the body from this to this. We can study a lot of things with the posturometer. Craniofacial system. Craniofacial system is the big disturber, and I want to teach you how to make a quick diagnosis. How they affect the posture. The oculomotor system, how affecting the posture. We have different ways, neurological ways, to study that. But mainly the refraction and the oculomotricity, that means vision and movement, affect the posture. Affecting directly the jaw position, affecting the eyes, and affecting the body who make adaptation. Forward and jaw position, lateral deviations. The lateral deviations of forward position is affecting directly the oculomotor system. That means one of the main receptors. I'll show you one clinical case. Look at here. Lateral deviation, hypoconvergence. Increasing the load laterally. Lateral deviation to the other side, also increasing the load laterally. Forward position. Not have overload, but we have barycenter alteration. The barycenter move forward or back, depending if we have the jaw back or forward. Imagine how stomatognatic system can alter, and how you can do a rehabilitation if you do not annulate that. It's disturbing every single day, the rehabilitation. That's why we need annulate it. Look at here, oculomotor system, as you see there, hypochondria. This is the test and the mouse. Oculomotor system altered, and the mouse situation related. Oculomotor system alteration and mouse. I can show you thousands of patients with the same problem, and nobody take care in this diagnosis. Everybody work alone. Don't work together, and you cannot work like this. Look at here, oculomotor system, body posture, mouse. Interdisciplinary point of view is important. Look at that situation. This patient is a patient who have pain. That's I call that patient my Robocop. This is a disaster. Have pain, lumbar pain. Nobody take care of the general situation, just the pain. He went to the surgeon, and the surgeon do operation. First here, more pain, operate here, more pain, operate. Because the only point of view was the pain, not seeing why is the causes of the pain. This is a disaster. Look at here, interdisciplinary point of view, scoliosis. Most of the scoliosis are adaptive scoliosis, related with the different problems of our body. Most of them, TMJs. Look at here, oculomotor system problem, mouse problem. How is affecting the posture? Deviation, generating stress, the jaw position. When we have a deviation of the jaw, is creating overload inside the temporomandibular joint. We know very well temporomandibular joint do not resist increase of depression. It deformed and created disease. You will see the only defense that central nervous system have is bruxisms. Look at here, we see a little video. This joint is covered by fibrocartilagens. If it's increasing depression, it's creating a disease. That's why it's very important, the jaw position. I try to teach that for a lot of people, mainly dentists, but for physiotherapists, for osteopaths. That is important because that jaw position, if it's wrong, is blocked by the teeth. And central nervous system said, this is the problem. We have to destroy the teeth. Look at that particular joint have muscles, have a capsule, have teeth, have a lot of things. That is a particular joint that we have to understand very well. We cannot treat that only with massage or osteopathic therapy, because the problem is here, blocking the jaw position, and central nervous system is creating bruxism to destroy the teeth, and it's creating hyperactivity of the muscles, it's creating hyperactivity in the neck and hyperactivity in the whole body and chronic disease. Connection between craniofacial system is through the yoides systems. The jaw position is connected with the yoides and with the rest of the body. Yoides is the main connection. Bruxisms is a defense, a very wrong defense that central nervous system has. It acts immediately because it's saying jaw position is bad for the temporomandibular joint. Teeth are blocking that. I have to destroy the teeth, and it's creating a problem who never stops. And he's creating muscle. Bruxism is not a stress, and it's creating chronic postural alteration. Here is the block, danger here, bruxisms. This is the circle. No stress. That's important to understand that. This situation is creating hyperactivity mainly there in the suboccipital muscles. Imagine you want to relax these muscles and the stomatogenic system is ever hyperactivity in the situation. You can never do a rehabilitation. Lower part of the cervical is related also with the jaw position. Yoides is the connection between upper part of the body and lower part of the body. And this is a very important system connected with the jaw, with the upper, with the suprayoides, and also connected with the neck, with the upper system. Jaw and neck. Jaw position is changing, is altering the biclavicular plane, is altering the neck position and the head position. This hyperactivity starts from the top and slowly going to the bottom until lumbar and feet. And we can stop that before it's arriving chronically. How? Investigating the problem. Nobody investigates that problem. They treat it. Bruxisms say danger is a defense and is creating a domino effect that is creating chronic pain and injuries. A common misconception is the bruxism is caused by stress. This is wrong. Bruxism is not caused by stress. Chronically, it causes stress. bruxisms increase the craniofacial sutures pressure. Imagine all the things that are creating a problem in the mouth. Look at here. Retroposition is creating hyperactivity in these muscles in the neck, and slowly hyperactivity in the cavity. Hyperactivity here, and slowing, going down. Lateral deviation block lower cervical spine. Forward and jaw position is blocking the first and second vertebrae. And slowly is creating problem in the neck, in the cervical area. Chronically is arriving to the grand dorsal, is arriving to these joints. Most of the problem there are related with the jaw position, and slowly going to the deep muscles, and is going lower, is arriving to the foot, and is creating adaptive scoliosis. Most of the scoliosis are adaptatives. We see some clinical cases. Lateral deviation creating overload and hypoconvergence. Overload in the posture and hypoconvergence. TMJ compressions, and in this case, is destroying the disc. TMJs and posture also. Hypoconvergence, jaw position. Look at here, joint, blockage, how the joint is affecting for the teeth blocked there. Always you see jaw position, hypoconvergence, hyperactivity, postural disease. How you can do rehabilitation if you don't observe that? It's impossible. The rehabilitation relieves because this system is disturbing ever your treatment. The cervical spine related with the jaw position. Adaptive scoliosis, increasing the curve in the lumbars. The jaw blockage. You see there, also there, jaw blockage, hypoconvergence. Jaw forward position, bilateral hypoconvergence. No overload, yes, changing the varicenter. How you can observe that? The main symptoms of the dysfunction are headache, dizziness, loss of the balance, noises in the ears, cervical pain, diffuse muscle pain, deviation of the jaw in opening and closing, craniofacial pain, and the symptoms: tiredness when patient wake up, difficulty in sleeping, tingling in the hands, lumbar pain, mandibular click, deviation when the patient open and close, clicking the joint, sometimes block, and sensation of the ears blocked. Imagine a lot of symptoms we can identify to prevent. This situation in a child, we have to intervene. This is the concept. To avoid to arrive like this in the future. This situation, if we leave it, it will arrive as an adult like this. That's why prevention is very important. Scoliosis. Most of the scoliosis are related with these things we are talking. Look at here. We have to see also anatomically if we have a real short leg or not. Mouth, posture, eyes. mouse posture eyes. It's repeatable. We can go infinitely. I can show thousands and thousands of patients, and nobody investigate that situation. We treat it. We treat the disease, no more. We don't go through the causes. And it's very simple. When you make a diagnosis, it's very simple to treat. Look at here. Adaptive scoliosis related with the things we are doing. Foot, mouse, posture. You see a lot of patients. I can show you a lot of clinical cases with the same problem. And we analyze in our study all these things to arrive to the diagnosis, to plan a treatment. Postural planes, we told you before, deviation of the body. We observe laterally also. And when we have a body anteposition, hypoconvergence always is repeating. If you analyze your patient, you will see all of them with these parameters. But nobody investigates that. Foot support. Imagine an osteopathic treatment and a physiotherapy treatment with these things that are disturbing your job. You will never have a permanent result. Look at here, the foot. We have to investigate in the patient. And this is very simple to treat. You will see physio can treat that. And you say, we cannot, this is a dental treatment. No, you can annulate. I will show you later. You can annulate that situation very easy. The only thing you have to understand that this situation is bad. I will show you how. Very simple. I invent some tool for physio to annulate that. Not for dentists. You don't need a dentist to annulate that. I teach medical doctor, osteopath, physiotherapists to annulate this situation. And in a very simple way. Lateral deviation. Always you will see mouse close, overloaded. Posture, eyes, foot support, overload. This is an instrument. It's measuring. It's an objective instrument. It's showing you what happened with the body. Posture, clinically. The symptoms, look at here. Headache, neck pain, muscle pain, dizziness, and TMJ clicking. Dentists think that they can treat only TMJs. And physio also, an osteopath thing, they can do manipulation, they can do massage. No, you have to see a good analysis and you have to understand what happened really with locally and the whole body. Always these are creating problems. And you see, posturometry, how it's changing, forward position, and overload. Stabilometry also, we can measure the body center. And also, you can measure the torsion of the body. Torsion of the body. With this instrument, you can measure a lot of things. One simple technique for physiotherapists to cancel the negative effect of craniofacial system. If you understand the things I am teaching, mouth, eyes, foot, we are not talking here about biochemistry because we need a special topic about that. I'm trying to synthesize the whole problem. But how you can about it with a simple instrument. I created that 20 years ago for all medical sciences. I call it BED, Body Equilibrium Device, because it's a simple thermoplastic device one size you can adapt it every patient, and you can deprogram the system, and your work will be better. You can deprogram, you can annulate the stomatognatic system dysfunction. Very simple. Obviously, you need a training not to manipulate that. It's very simple. It's a very simple device for all medical sciences to annulate, cancel the craniofacial system interferences. With hot water, and you can adapt the device, annulate the muscle dysfunction, have different shapes. No, it's very simple to use. And look at some clinical cases. Important device in sport, because sportive have problem in the mouth, and they don't know that performance decrease if craniofacial system is disturbed. This is a research I did many years ago with sportive. One of the research problems in the body, problems in the mouth. You see in him also the dysfunction, the teeth, lateral deviation, problem in the mouth, deprogramming, and we create a good situation in the body, measure it, and the performance increase. Patient with chronic pain, jaw position. Look at before and after the face, how it's changing when you annulate the stress of the craniofacial system. And how is the balance? Just annulating, you are not treating the mouth, but you need to annulate to have a good body rehabilitation. A lot of patients I can show you with dysfunctions, a lot of patients with posture alteration, postural planes alter, the jaw position, look at the jaw, how it's bad, hypoconvergence. And here, look at here, before and the programming, how it's changing. Conclusion for the, I hope in this short time I can explain all these things. Now, it is important to know the neurophysiological connection within the body. That's very, very important. The negative role of craniofacial system dysfunction on the muscular change is forgotten in physical rehabilitation. And I tell you, that's happened all around the world. We are trying to change this concept. The people who are formatting in our school, we're formatting more than 2,000 people around the world. They know very well that, and they work better. The treatment of choice is always holistic diagnosis and interdisciplinary therapy. We cannot work alone. In rehabilitation, it is necessary to cancel the negative effect in order to carry out a good therapy that lasts over time. The therapy of choice is undoubtedly osteopathy in postural concept, since it takes this type of diagnosis and treatment into consideration, not just manipulation. We will start the postural master. We will do with your university this theory and practice with Postural Osteopathy to understand the concept of the osteopathic postural osteopathy, the concept to do manipulations in this way. That master is for physiotherapists only. Not for physiotherapy. We do that for medical doctors, dentists, and physiotherapists. No, but in your case, you're a physiotherapist. No, we will start to learn holistic diagnosis, clinical posturology, clinical posturometry, stomatognatic diagnosis, NPR interdisciplinary therapy, neuromuscular re-education, postural rehabilitation exercises, osteopathic maneuvers in our concept, craniosacral maneuvers, NPR devices to use with osteopathy, oculomotor system rehabilitation, biochemical therapy, proprioceptive rehabilitation, and force support therapy. It's a very, very complete master that we will do with your university. And the practice will be in Spain. Will be in the University of Canary Islands. It's in the Physiotherapist University. We will do the practice there. One practice a year. This is 2 years master. We will learn the osteopathy with an holistic interdisciplinary approach. That is important. You can use the NPR tools, international faculties, hand workshops, comprehensive diagnosis, collaborative interdisciplinary treatment plans. We can postural rehabilitation osteopathy. This is our master. This is our master. This is our master that we will start. I hope we see a lot of you in this formation. This is an international formation, and I think in the future I will see a lot of you in our master in collaboration with your school. Thank you so much to be here, and I will see you in the next webinar. Bye bye everybody.